Can a decision support tool help clinicians choose the best antidepressant for patients with depression? How much sleep are U.S. adolescents really getting? How is rural health funding allocated under the Rural Health Transformation Program? This and much more on today's JAMA Editor's Summary. Hello and welcome to our listeners all around the world. Today is Friday, March 6, 2026. I'm JAMA Deputy Editor Dr. Linda Brubaker, sitting in for Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief of JAMA and the JAMA Network. Today, I'm joined by JAMA Deputy Editor Dr. Preeti Malani. Hi, Preeti. Let's get started.
Hi, Linda. Antidepressants are one of the first-line options for patients with moderate to severe symptoms of major depressive disorder, which currently affects about 280 million people worldwide. However, ways to implement a more personalized approach to antidepressant treatment are limited, and many people prematurely stop therapy. Dr. Cipriani and colleagues evaluated the efficacy of a web-based tool called Petrushka, which stands for Personalizing Antidepressant Treatment for Unipolar Depression, Combining Individual Choices, Risks, and Big Data. This tool combines clinical and demographic predictors with patient preferences for personalized antidepressant treatment. In this multi-center randomized clinical trial, more than 500 adult participants with major depressive disorder were randomly assigned to receive either the Petrushka tool or usual care. The primary outcome, treatment discontinuation due to any cause at 8 weeks, was less likely when individuals received a personalized antidepressant selected using the tool, 17% compared with 27%.
Dr. Simon wrote an accompanying editorial and commented that, quote, "While clinicians wait for genomics, proteomics, or another field to reveal underlying biology and transform care for depression, patient preference appears to offer important clinical benefit with little risk, cost, or treatment delay." Preeti, let's dive into the research letters this week.
Great, Linda. Let's start with adolescent sleep. Dr. Bummersbach and colleagues analyzed cross-sectional data from the 2007 to 2023 National Youth Risk Behavior Survey to assess national trends in insufficient sleep among U.S. adolescents. In this nationally representative sample, which included more than 120,000 U.S. high school students, the investigators reported that insufficient sleep, which was defined as less than or equal to 7 hours per night, increased from about 69% in 2007 to nearly 77% in 2023. This increase was driven by a rise in very short sleep, which was defined as less than or equal to 5 hours, which increased from about 16% to 23%. These increases in insufficient sleep occurred across all demographic subgroups and nearly all behavioral subgroups, and increased much more among students without behavioral risks.
In another research letter, Dr. Chatterjee and colleagues assessed state-level funding from the Rural Health Transformation Program. This program, created in July 2025 under the One Big Beautiful Bill Act, was designed to help offset reductions in federal Medicaid spending, addressing financial challenges for rural health care and improve rural health care. In their cross-sectional analysis, the investigators reported that total program funding varied among states without a clear relationship to the size of the state's rural population. They also reported that states with the lowest rural mortality received more than twice the funding per rural resident as states with the highest rural mortality, suggesting that the program's current funding allocations may not align with rural health and access needs.
JAMA published a perspective article in which Dr. Lantos examines how the physician's role may change and evolve in the age of artificial intelligence. It's an interesting read, tying together examples from art, philosophy, and of course, medicine.
There's also new clinical content in JAMA, including a review on chronic non-infectious diarrhea, a condition that affects 6 to 7% of U.S. adults. Dr. Singh and colleagues review the most common causes, diagnostic workup, and therapies for this condition. You could also hear JAMA Deputy Editor Dr. Mary McDermott discuss more with co-author Dr. Che on the JAMA Clinical Reviews podcast. Let's hear a clip.
Can you talk a little bit about what are the most common causes of chronic diarrhea?
By far and away, the two most common causes of chronic diarrhea are irritable bowel syndrome with diarrhea and functional diarrhea. These are both disorders of gut-brain interaction that are defined by the presence of diarrhea, and patients with IBS-D also have abdominal pain or discomfort. Patients with functional diarrhea typically don't have abdominal pain or discomfort, at least as one of their predominant symptoms.
Doctors Peters and Jennings contributed a JAMA Insights article about using numerical comparisons to help patients make choices. The authors include some very helpful examples of different communication approaches for clinicians to consider. And in the latest JAMA Guide to Statistics and Methods, Dr. Overby and colleagues explain the Hochberg procedure, a statistical approach for the comparison of multiple endpoints, using examples from the FAIR HF2 trial published in JAMA in 2025.
And while we are on statistical topics, you can learn a great deal from the new JAMA Evidence podcast as JAMA statistical editor Dr. Roger Lewis talks to Dr. Webb about platform trials and how they can offer an efficient evaluation of multiple treatments. Here's a clip of their discussion.
What is a platform clinical trial, and how does it differ from a more traditional approach to clinical trials?
Well, a traditional clinical trial typically just answers a single question, and it represents a piece of one-off infrastructure to answer that question. In contrast, a platform trial can be regarded as any clinical trial in which multiple questions can be addressed, typically simultaneously, but also in sequence within a single trial protocol. And that creates some advantages.
As always, there's a lot happening in health and medicine. The JAMA Medical News team has a summary podcast that publishes every Friday with the latest in medical news. You can subscribe at jamamedicalnews.com or click on the link in this episode's show notes.
Thanks, Preeti. And thanks to our listeners for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Linda Brubaker. This episode was produced by Daniel Musisi, Shelley Steffens, and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in this episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.